Welcome to the Noctura 400 sleep mask tutorial video. Noctura 400 is for the treatment of diabetic retinopathy and should only be used as recommended by your clinician. This video will inform you of basic operations and handling procedures for the Noctura 400 sleep mask. You will either receive your sleep mask from your clinician or through the post. Your Noctura bag will contain the following items: the instructions for use, 3 fabric masks to be used during the 12-week period, a sealed envelope containing the pod, 4 pod wipes and a return envelope. Ensure you have all the items listed before you start. Read the instructions for use carefully before proceeding. Take note of all warnings and guidelines given. On the front of the pod packaging, you will notice a quick start guide should you need a quick reminder on how to use your mask. On the reverse side, you will see your patient information along with the operational window details of the pod itself. In this case, the pod can be used between 8 p.m. and 8 a.m. each night for 12 weeks from the 14th of January to the 7th of April 2014. The mask has been designed to be worn for up to 8 hours at night during your normal hours of sleep. Open the envelope and remove the pod from its protective wrapper. The pod is plain on the back. On the front, there are 2 light-emitting sources that shine into the eyes through closed eyelids, an on sensor and sensors to detect when the mask is on your face. The fabric mask is used to hold the pod in place over your eyes. Open one of the fabric masks and discard the packaging. Notice that the strap has a Velcro fastening. Slide the pod fully into the fabric mask. It is important to keep the mask clean at all times. Remove any makeup, as this will contaminate the fabric mask. Remove any glasses, and make sure there are no obstructions to interfere with the mask fastening, such as any hair accessories. Secure the mask around your head using the Velcro tab. The mask should be firmly held in place around your eyes, but not too tight to be uncomfortable. Once you're happy with the fitting, slip the mask off your head and store, away from electrical items, metallic surfaces and moisture, until you're ready to go to bed. When you're ready to go to bed, remove any glasses, contact lenses, makeup, false eyelashes, face masks and hair accessories before wearing the mask, as all of these things may interfere with the therapy. The pod is activated by gently touching and holding the on sensor for 3 seconds. This can be done by either removing the pod from the fabric mask or by sliding your finger into the fabric mask and lightly touching the sensor. It is important not to press the on sensor. It is not a button. Excessive pressure could damage the sensors in the pod. It is important to secure the mask in place within 3 minutes of activating the pod. If the mask is not in contact with your face, the lights will go out after 3 minutes. If this happens, reactivate the pod by gently holding the on sensor and replace the mask on your face. Once the activated mask is in place over your eyes, close your eyes. The therapy operates through your eyelids. It may initially appear bright, but your eyes will adjust. After 15 minutes of contact with your face, the lights will stay on for 8 hours of therapy. The delivered dose is detected by the face sensors, and your use of the mask is recorded. Wear the mask all night. After 8 hours of use, the night's therapy is complete, and the lights will go out by themselves. If you normally sleep for less than 8 hours, simply remove the mask when you're ready to get up. The lights will continue for a full 8 hours before turning off, but you don't need to wear it if you're getting up. In the morning, remove the mask and place in a suitable location for storage throughout the day, away from any electrical equipment or metallic surfaces. If you get up in the night, remove the mask. Place on a bedside table, away from electrical equipment and metallic surfaces, and replace over your eyes when you return to bed. Use the mask every night until the operational window has expired. At the end of the 12 weeks, a replacement pod is required to continue the therapy. You must clean the pod with a wet wipe provided and seal in the return envelope. Return the pod to your clinician, who will then give you a replacement mask. Please remember, outside the operational time and date, the pod will not activate. If inside the operational window, the pod does not activate or does not stay on, try leaving it for a few minutes before trying again. If after a number of tries it still does not work, the pod may be faulty. Please contact the helpline provided by your supplier during working hours. If you miss one night of wearing the mask, it will not affect the treatment. The on sensor only requires a light touch. Keep the pod dry at all times. It is important to keep and store the pod away from electrical equipment and metallic objects at all times. Read the instructions carefully and only use as recommended by your clinician. Thank you for your attention. We hope you enjoy using Noctura 400.